Welcome to Relax and Learn Medical, where your mind may absorb knowledge while you unwind to the gentle sounds of 432 Hz healing music and breathtaking natural landscapes with 140 facts about the human ear. This is your peaceful space to explore the human body in depth, one fascinating system at a time. Today we gently turn our focus to a marvel of design and function, the human ear. So take a deep breath, get comfortable, and let's begin our calming journey through the wonders of the ear. The human ear has three major parts: the outer ear, middle ear, and inner ear, each with a unique and essential role in hearing and balance. The outer ear captures sound waves and funnels them through the ear canal to the eardrum. The middle ear contains three tiny bones, the malleus, incus, and stapes, collectively called the ossicles. These are the smallest bones in the human body and amplify sound vibrations. The inner ear houses the cochlea, a spiral-shaped organ filled with fluid and sensory cells that convert vibrations into nerve impulses for the brain. Tiny hair cells inside the cochlea detect sound frequencies and send messages to the auditory nerve. The eustachian tube helps equalize air pressure between the middle ear and the outside environment. This is why your ears pop when you fly. The ear also controls balance through the vestibular system, made up of semicircular canals filled with fluid and lined with sensory hair cells. When you move your head, fluid in the semicircular canals shifts, and the brain uses this information to maintain your equilibrium. The stapes, also called the stirrup bone, is only about 0.1 inches long, making it the tiniest bone in your entire body. Humans can detect sounds from about 20 Hz to 20,000 Hz, though this range narrows with age. The ear never sleeps. Even when you're asleep, your ears still pick up sounds. Your brain just tunes them out. Earwax, or cerumen, protects your ear canal by trapping dirt, dust, and bacteria. Some people produce dry earwax, while others produce wet earwax, a trait influenced by genetics. The pinna, the visible part of the ear, helps locate the direction of a sound. The shape of each person's pinna is unique, like a fingerprint. Sounds travel through the ear as mechanical energy, then become electrical signals in the brain. Your brain determines the location of a sound based on the slight difference in how long it takes to reach each ear. Ears help with spatial awareness, letting you know if something is above, below, or behind you, even if you can't see it. The cochlea contains about 16,000 hair cells, and once they're damaged by loud noise or aging, they cannot regenerate. Hearing loss affects over 430 million people worldwide, according to the World Health Organization. Tinnitus, a persistent ringing or buzzing in the ear, can result from prolonged exposure to loud noise or ear damage. Swimmer's ear is an infection of the outer ear canal caused by water remaining in the ear after swimming. The ear is connected to the throat and nose via the eustachian tube, which is why infections can travel between them. Babies are born with full hearing abilities and can respond to sound even in the womb. Listening to music or loud sounds through earbuds at high volumes for long periods can permanently damage hearing. The balance system in your inner ear communicates constantly with your eyes and muscles to keep you steady. When you're dizzy, it often means there's a mismatch between what your eyes see and what your inner ear feels. The cochlea looks like a tiny snail shell, a name that actually means snail in Greek. When you yawn or chew gum, you help open the eustachian tube, which relieves pressure. Hearing aids amplify sound and are useful for mild to severe hearing loss. Cochlear implants are electronic devices that can bypass damaged parts of the ear to restore hearing. Ears also play a role in emotional responses to sound, such as music or a loved one's voice. Sound can affect mood, stress levels, memory, and even heart rate. The ear is a gateway, not just to hearing, but to connection, communication, and balance in life. The human ear begins developing just 3 weeks after conception. By the 5th month in the womb, a baby can already hear external sounds. Ear shape helps amplify specific sound frequencies, especially speech tones. The pinna also helps protect the ear canal from foreign objects. The ear canal is slightly curved to protect the eardrum from injury. The tympanic membrane, eardrum, is only about 0.1 mm thick, thinner than paper. The eardrum vibrates less than a billionth of a centimeter in response to soft sounds. The ossicles amplify sound by up to 22 times before it reaches the inner ear. Without the ossicles, you'd lose 95% of your hearing sensitivity. The oval window is the membrane where the stapes transfers vibrations to the cochlea. Fluid inside the cochlea stimulates hair cells as it moves with sound waves. Different parts of the cochlea respond to different frequencies, high at the base, low at the apex. Sound travels faster through bone than through air, which is why you hear your own voice differently. You hear your own voice through bone conduction, while others hear it through air conduction. The basilar membrane inside the cochlea helps distinguish pitch and tone. Loud noises can damage cochlear hair cells in as little as 30 seconds. Once hair cells are damaged, the hearing loss is usually permanent. The vestibular system includes 3 semicircular canals oriented in different planes to detect rotation. The utricle and sacculae detect linear movements like jumping or moving forward. Small crystals called otoliths help the vestibular organs detect gravity. Motion sickness occurs when your vestibular system and eyes send conflicting signals to the brain. Vertigo is a condition caused by dysfunction of the vestibular system, making you feel like you're spinning. Balance can be tested through a Romberg test, which examines stability with eyes closed. Age-related hearing loss is called presbycusis. Men are more likely than women to experience hearing loss with age. Sudden sensorineural hearing loss can happen within hours and requires urgent treatment. Ear infections are more common in children due to shorter eustachian tubes. The mastoid bone behind the ear contains air cells that help with middle ear pressure. The earlobe has no cartilage and is rich in blood flow, sometimes used for temperature measurement. Some cultures practice ear candling, though it's not medically recommended. Wearing earplugs or earmuffs protects hearing during concerts or loud environments. Barotrauma is ear damage caused by changes in air or water pressure, often during flying or diving. Divers can experience ear squeeze if they descend without equalizing pressure. The acoustic reflex causes a tiny muscle to contract when loud sounds occur, protecting the ear. The tensor tympani and stapedius muscles help modulate sound within the middle ear. Hyperacusis is a condition where normal sounds seem unbearably loud. Misophonia is a strong emotional reaction to specific sounds, like chewing. The auditory cortex processes hearing in the brain's temporal lobe. The right ear tends to be more involved in processing speech in right-handed people. Binaural beats are an auditory illusion used for meditation and brainwave entrainment. ASMR, autonomous sensory meridian response, uses soft sounds to trigger relaxing sensations in some people. The ear can detect pressure changes as small as 1/1,000,000th of atmospheric pressure. Prolonged exposure to noise above 85 dB can cause hearing damage. Hearing loss can increase the risk of cognitive decline and dementia. The human ear canal is self-cleaning. Wax moves out naturally during jaw movement. Itching ears can sometimes be caused by eczema or fungal infections. Otitis externa, swimmer's ear, can cause redness, pain, and discharge. Cholesteatoma is an abnormal skin growth in the middle ear that can damage structures. A ruptured eardrum often heals on its own within a few weeks. Ear barotrauma is common during airplane landings or scuba diving ascents. Tympanometry is a test that measures how well the eardrum moves. A pure tone audiogram charts hearing sensitivity across frequencies. A person with perfect hearing has a hearing threshold of 0 dB. Bone-anchored hearing aids use vibrations to stimulate the cochlea directly. Otology is the medical study of the ear and its diseases. Ear piercings are usually done on the lobe, but can also be done on the helix, tragus, and conch. The phrase "playing it by ear" originally referred to musicians who didn't use sheet music. The cochlear nucleus is the first place in the brain that processes sound input. Each cochlea is about 35 mm long and coils about 2.5 times. Ear prints are unique and can be used for biometric identification. The ear contributes to taste. The chorda tympani nerve runs through the middle ear and affects taste on the tongue. Some migraines affect the ear, causing ringing or temporary deafness. Noise-induced hearing loss is 100% preventable with proper protection. Ear seeds used in acupuncture are placed on auricular points for relaxation or pain relief. Earwax naturally contains antimicrobial properties to fight off bacteria. The term auricle refers to the visible part of the outer ear. Some people experience ear popping when they sneeze due to eustachian tube pressure shifts. Glue ear is a common condition in children where fluid builds up behind the eardrum. The first successful cochlear implant surgery was done in 1961. The helicotrema is the apex of the cochlea where two fluid chambers meet. Damage to the auditory nerve can result in complete deafness even if the ear structures are intact. Otitis media is the most common ear infection in children and often accompanies colds. Acoustic neuroma is a benign tumor that affects the hearing and balance nerves. The middle ear cavity is air-filled and about the size of a pea. Pressure equalization tubes, PE tubes, may be inserted in children with chronic ear infections. Microtia is a congenital deformity where the outer ear is underdeveloped. Otoacoustic emissions are tiny sounds the cochlea emits during hearing tests in newborns. Ears continue to grow slightly throughout a person's life due to gravity and cartilage changes. Cochlear implants provide digital sound. In space, no air means no sound. Ears help coordinate posture. Ears respond to emotional and musical stimuli. Ancient Chinese medicine mapped organs on the ear. Babies can recognize their mother's voice shortly after birth. The ear canal has acidic pH to discourage infection. Sound vibrations in water are sensed differently. You lose high-pitched sounds first in hearing loss. Prolonged headphone use can increase bacterial growth. Your ears help determine how far away a sound is. Brain scans show that music activates emotional brain centers. The human ear is a masterpiece of sensory design, balancing function, emotion, and survival. Age-related hearing loss typically affects high-frequency sounds first. The word aural refers to anything related to the ear or hearing. Auricular hematoma, common in wrestlers, can lead to cauliflower ear. The vestibulocochlear nerve, cranial nerve vate, carries both hearing and balance signals to the brain. The organ of Corti, within the cochlea, contains the sensory cells for hearing. Ear thermometers use infrared sensors to detect eardrum temperature. The scala vestibuli, scala media, and scala tympani are the three chambers of the cochlea. Earmuffs and earplugs are essential in occupations with chronic noise exposure. The term deaf may refer to profound hearing loss, while hard of hearing refers to mild to moderate loss. Sign language is a full visual language used by many deaf individuals around the world. Cochlear implants do not restore natural hearing. They provide a new way to perceive sound. In space without air, you cannot hear anything, even with perfect ears. Your ears are vital for maintaining posture and movement coordination. The human ear serves more than just the sense of hearing. It embodies a remarkable blend of sensory accuracy and evolutionary brilliance. We appreciate your time during this exploration. We hope this journey enhances your understanding of this small but mighty organ. Continue to embrace curiosity, find tranquility, and keep expanding your knowledge with Relax and Learn Medical. Don't forget to like and subscribe for additional videos.